Getty. Liberal Democrat Alex Cole-Hamilton. Scottish Labour Health spokesman Anna Sarwar vented frustration in 2017. 338,933 operations were scheduled by NHS Scotland, with 22,939, 6.8%, cancelled by either the hospital or the patient, new figures show. But 6,874, 2%, were cancelled by health boards for capacity and non-clinical reasons. Reasons include the unavailability of beds, staff and equipment, as well as employee illness, dirty equipment and theatre sessions overrunning. December was the worst month for such cancellations, with 778, 3.2%, operations axed, the highest level since January 2016. The SNP government was accused of leaving the NHS to struggle with unsustainable pressure. Many of these cases will leave patients living in further pain until they finally get the procedure they need. Anna Sarwar. Scottish Labour Health spokesman Anna Sarwar said, an average of almost 19 operations cancelled every single day in 2017 because hospitals couldn't cope should set alarm bells ringing in the government. Many of these cases will leave patients living in further pain until they finally get the procedure they need, and that can have knock-on effects for the work, family and mental health. Alex Cole-Hamilton, for the Liberal Democrats, added these cancellations cause stress and disruption to the patients being prepared for operations that didn't take place, as well as the families and NHS staff. To make matters worse, we already know that the number of cancelled operations in the first month of 2018 is set to be considerably worse, with one consultant describing the situation as absolutely catastrophic. Meanwhile, it emerged a target for 60% of Scots between the ages of 50 and 74 to be screened for bowel, established a decade ago, has still not been met. In the 2 years to May 2017, just 56% completed home testing kits, despite the importance of earlier diagnosis. 65% of those in affluent areas had been screened in the last 2 years, compared to 42.9% in the most deprived parts of Scotland. Janice Preston, of Macmillan Cancer Support Scotland, said, it's clear a new approach to early detection is needed. Getty. In 2017, 338,933 operations were scheduled by NHS Scotland, with 22,939 cancelled. Health services and campaigns consistently struggle to engage people from deprived areas. Separate figures published yesterday also showed accident and emergency departments again missed a key waiting times target. Of 141,988 people who attended casualty last month, 85.1% were seen and either admitted, transferred or discharged within 4 hours, below the target for 95%. Health Secretary said the government had invested £41 million in its Detect Cancer Early programme and £5 million earmarked for screening programmes. Thursday, February 9, 2017, responding to the cancelled operation figures. She added December had been exceptionally challenging as a result of winter pressures, including icy conditions and an increased flu rate. She said, despite those challenges across the system, over 700 operations a day took place, and just 3.2% of planned operations were cancelled due to capacity and non-clinical reasons, that is due to sound winter contingency planning and thanks to health and social care staff going the extra mile and delivering exemplary care. Individual boards will always take decisions in response to local circumstances, and, while cancellations are unavoidable, we are clear that patients with the greatest clinical need should not have their operations cancelled.